ada situation di mana lelaki akan datang and dia akan secara jujur kata, look, saya ada hubungan di luar daripada perkahwinan saya. And saya tak tahu kenapa bila bersama isteri dia tidak dapat capai kualiti ereksi yang bagus, tapi dengan pasangan di luar wedlock,
very good,
he is a superstar.
Yeah. Hidup dia, okay, in that stressful life is involving his wife. Okay, is involving his family members and all of that. He's living in that bubble of stress. Okay, that relationship outside of marriage is his release. When he goes there, he doesn't have this stress. I'm not saying that that is right, but I'm just giving
what's happening.
What's happening realistically, psychologically, what's happening.
Medical field ni pancreatic cancer.
Bersama saya Dr. Roland Victor.
Benda yang one of the worst stress can happen bila you makan tak sedap.
Doktor, saya punya culture kena makan nasi.
Zaman moden.
But that every second of your life you either earn or learn.
Batu Medic Show. Okay, what's up everybody? Selamat datang ke another episode of Lesung Batu Medic Show. Hari ni kita akan bercerita tentang isu kesihatan lelaki, tentang isu mati pucuk. Adakah ia disebabkan oleh mati di otak, kepala ke atas ni? Dan bersama saya hari ni ialah Dr. Deeban daripada Medical Clinic. Sempena dengan bulan November ni bukan bulan kesihatan lelaki. So hari ni kita nak pergi kepada satu topik yang melibatkan kesihatan lelaki, di mana kita tahu sebagai doktor, saya dan Dr. Deeban, kita selalu akan lihat lelaki akan datang ke klinik dan mengalami masalah kesihatan lelaki. Sama ada mati pucuk, kurang kualiti ereksi, dan the spectrum ni besar. Sama ada yang datang daripada umur 20-an sampai yang dah bersara pencen, dan mungkin yang dah pencen dah akan kahwin kedua ketiga pun ada. Okay. Tetapi kadang-kadang we see nombor, we see the numbers dalam blood report. Tak ada masalah dalam blood report. Adakah anda bersetuju dengan benda?
Setuju sangat. So memang banyak pesakit yang datang mengatakan bahawa mereka ada masalah mati pucuk, tak dapat perform dan sebagainya lah kan. Okay, so as doctors, yes, kita siasat, dan I would say banyak yang sebenarnya dari segi kesihatan badan tu memang tak ada masalah. Okay, fungsi badan dari segi otot, salur darah, jantung dan sebagainya, whatever it is, the body, physiology, tak ada masalah langsung. Nothing that we can detect. Okay, tapi ramai yang tak faham bahawa erection ataupun masalah mati pucuk ni sebahagian besarnya boleh disebabkan oleh kesihatan mental juga. Your mental health plays a big role in influencing your erections.
Betul.
So of course, for you to get an erection ni senang cerita, dia macam lampu lah. Kita nak on lampu ni, dia mesti ada sumber elektrik dan dia mesti ada wire elektrik. Okay, so wire elektrik ni macam badan. Okay, so kalau wire elektrik ataupun badan ada masalah pun dia akan affect your erection. Okay, kalau sumber elektrik or your thoughts, your mental health pun ada masalah, pun akan menyumbang kepada masalah erection juga.
Betul. Okay, so Dr. Deeban, kadang-kadang di klinik kami akan lihat patient yang ada peratus testosteron yang cukup bagus, peratus estrogen yang cukup rendah. Mungkin dari segi inflamasi badan, keradangan badan, CRP, everything low. Tetapi dia akan kata, doktor, masih tak ada kualiti ereksi yang bagus. So adakah kalau kita lihat dari segi mental mempengaruhi kesihatan lelaki ni? Okay,
so most definitely memang dia akan mempengaruhi kesihatan lelaki, especially kalau kita bincang tentang masalah mati pucuk ni kan. Okay, so contohnya macam saya cakap tadi, fiziologi mungkin normal, maksudnya kalau tengok blood work semua okay, your inflammatory markers, tahap keradangan dalam badan, tahap kesihatan badan semua okay, tapi dia tak membawa apa-apa information tentang kesihatan mental seseorang tu. So seseorang tu mungkin ada kemurungan, mungkin ada depression, so ada perubahan kimia dalam otak dia yang boleh menyumbang kepada masalah mati pucuk. Contohnya kalau dalam depression ni orang kemurungan, dia tak ada mood nak buat apa-apa, there is nothing positive in his life, to his perspective lah. Perspektif dia tak ada apa-apa yang mengujakan, tak ada apa-apa yang menggembirakan dia. Orang yang tak gembira, kalau you tak gembira, you ingat you nak buat hubungan seksual ke? Nak buat hubungan intim ke? Tak mungkin kan? So you dah rasa you are worthless, you rasa you nak bersama dengan orang lain, tak akan ada. So natijahnya ialah bila you dah tak ada rasa macam tu, okay, you dah tak ada arousal, you tak ada orang kata rasa berahi, rasa nafsu, tu dah tak ada. Nafsu tu yang paling penting untuk menjana hubungan, untuk menjana erection, nak menjalinkan hubungan intim tu, nafsu tu penting. Kalau nafsu tu pun dah tak ada, then of course you tak akan ada apa-apa erection. You won't have any form of erection or whatsoever lah. So definitely that will play a part.
Betul. And then kalau kita lihat juga dari segi people yang mungkin mengalami masalah psikologi, yang mungkin tengah mendapatkan rawatan seperti SSRI and everything kan. So itu pun secara tidak langsung akan menyebabkan certain hormon dekat otak akan suppress, dan mereka akan rasa macam mereka tak ada keinginan. Libido akan drop, nafsu tu akan drop. Tetapi mereka tidak diberitahu this is the impact. So when they say, hey, saya telah ambil ubat ni. Terutama sekali, I think more of the foreign patients. Orang Malaysia ni mungkin nak pergi ambil ubat penenang ni semua unless terpaksa sangat.
Dia selalu orang Malaysia ni dia orang Asian population lah. Dia lebih konservatif sikit. So dia kalau tak boleh, dia nak elakkan ubat dan sebagainya. Bukan nak cakap contoh. Back to your same topic, patient yang ada kemurungan. Sekarang ni diperlukan ubat untuk nak suppress a few hormones, release a few hormones so that mood dia berubah. Yes, I setuju, ada kemungkinan dia akan menurunkan libido dia. Ubat tu sendiri akan menurunkan libido dia. Alright, but you always look at, are you looking at treating one disease or you want to treat the crux of the problem here? So masalah erection tu is not as big as the psychological issue. So treat the psychological issue first. Of course, when you have a handle on it, so bila you dah dapat manage, kawal masalah psikologi tu lebih bagus, then your erection improves. Of course, your libido and all comes back. But I agree, yes, some medications dia akan mengubah hormon-hormon, dia akan mengubah paras hormon dalam otak, kimia dalam otak yang boleh menyebabkan masalah ini sendiri. Tapi don't forget, masalah yang sama kalau tak dirawat pun akan menyebabkan masalah erection juga. Betul.
Dia akan jadi macam satu Ferris wheel.
Exactly.
Akan berkisar. Tetapi also to see, yang I said, we don't see that much because the foreign people yang banyak penggunaan benda ni. Dan tapi kita lihat juga dari segi lelaki sekarang. I think lelaki sekarang lebih terbuka sedikit nak bincangkan sedikit compared to lelaki yang mungkin our dads punya generation lain sikit. Mereka betul-betul keras kepala. So
our generation lah.
Our generation itu mungkin ada sikit. And tekanan emosi, not just because of depression, because of the stress ataupun kekangan kerja, majikan, hubungan dengan suami isteri, ataupun dia ada girlfriend ke kekasih ke apa macam tu, that tug of war sometimes brew up, jadi terlampau besar, and affects the mental stature. And then yang paling pelik I perasan is, ada situation di mana lelaki akan datang and dia akan secara jujur kata, look, saya ada hubungan di luar daripada perkahwinan saya, and saya tak tahu kenapa bila bersama isteri dia tidak dapat capai kualiti ereksi yang bagus, tapi dengan pasangan di luar wedlock,
very good,
he is a superstar.
So comes back to again, banyak when you live in a stressful environment, everything eats up into your arousal. So taking that, kita ambil contoh macam seorang lelaki yang ada hubungan di luar realm perkahwinan dia lah kan. So dia ada a second partner. Hidup dia in that stressful life is involving his wife. Is involving his immediate life, his family members and all of that. He's living in that bubble of stress. So that relationship outside of marriage is his release. That stress doesn't affect him. It's his ghetto lah basically. That's his release, right? It gives him that leeway. I come out of this bubble. So when he goes there, he doesn't have this stress. I'm not condoning. I'm not saying that is right. But I'm just giving what's happening. Realistically, psychologically, what's happening. He feels a relief there. He's not affected by his stress. So people think, sex is both procreational and recreational, right? So that means to say you do it because you want to have offspring. You also do it because you enjoy it. You think of it as a stress relief. But when you but don't forget that although it's stress relief per se, it is still stressful to your body, right? So, and other forms of stress also affects your arousal, affects your ability to perform, to get an erection. All right. So if you're under constant stress, physical, be it financial stress, be it something that's bugging your mind at all times, you're not going to be able to perform. But when you come out of that bubble, okay, you forget about everything else. You are sort of, to say, reborn. Like your mind is clear. Okay, you don't have any of those worries weighing down on your mind. Kan? So at that time, yes, mentally you are more perceptible to be aroused mentally, and that feeds your erection. But what happens is when that relationship, for example, that relationship will feed your guilt. For example, if you have you have a conscience, okay, you have the guilt, alamak aku dah tercurang, okay, you ada rasa rasa bersalah, okay, then dengan pasangan tu pun you akan ada masalah yang sama because your mind is now is stressed out.
And I mungkin nak tambahkan dari segi the psychological part, when bila mereka balik kepada the current relationship, dia akan bawa element of dia rasa dia berdosa. So this our masyarakat ASEAN ni, dia punya indoctrination, the psychological indoctrination is, you see, sex is, intimacy is always after marriage.
After marriage, yeah.
That's like the principle, the creed. And then religion punya background. So kita nampak dari segi kebanyakan agama pun, the concept of curang ni memang tidak diterima.
Yeah.
So it's like not accepted by God kind of position. So there's this God complex coming where you say like, oh my God, I screwed up. So when they go back home to their partner at home, dia akan bawa the element of, you know what, I don't know how to tell you, but I'm just holding this in.
Yeah.
That I've been doing this.
Yep. And that's always playing at the back of their mind. And what happens? So most often the partner is caught off guard. Partner starts blaming themselves.
Betul.
All right. So for example, the husband cannot perform. The wife thinks she is the problem. It need not be. You're not the problem here. The problem is that he has this complex. He has this sin. I have sinned kind of a thought going on in his head, and that is eating him up. Okay.
True.
And having to say that, so that is one situation. I've also seen situations where, so berbanding dulu, laki sekarang lebih banyak tengok benda-benda dalam media. Okay. So be it pornography, certain portrayals and all that, right?
Not even pornography these days.
Yeah.
I akan cuba salahkan even all the media masa sekarang. Satu, mereka gunakan clickbait yang very sexually driven.
Okay.
Kedua, we are targeted. We're targeted as a male and female in social media. Kalau you just scroll through Facebook or Instagram, you will start questioning like, why am I being sent this kind of images?
Exactly.
Then I feel like, aku bukannya layan benda ni. Why it's like, it is almost like
the algorithm is set as such. Yeah.
Set as such that you will want to see and hold and stop and seeing. I consider it is like now, like this is like the whipped cream of soft porn.
Okay.
That's what I would define it. It's like they just want to tease you, hey, stop and see, kind of thing.
Yeah.
But there is no such thing as like, please don't send me this kind of. They don't have that option.
Yeah. So I think So back to that. I think so when we view this kind of when men view this kind of things, content and all of that, right? So they always believe that no matter the situation, no matter what, they should be able to perform. You should be raring to go at all times. That's not true. That's
fast
not
and
true.
furious.
You must be fast and furious at all times. No, that's not true. Okay. So, like for example, you come back, you have a stressful day. You're physically stressed. I'm not talking about mental stress at all. Okay, just pure physical stress. Okay.
Ini segmen lain pula. You answer my question.
Yeah.
Go ahead.
So you just want to rest. Your body just wants to rest. Okay. At that time, you really think that you can be aroused? No, but you think that, okay, let's say suddenly your partner says, okay, I want to have intercourse per se. Okay. But you are really fatigued. Your body is not going to cooperate. Because why? Sex itself is physically demanding, it's demanding on you physically. Your body's already tired. You really think your body wants to go the extra mile to perform again? It won't. And what will happen? You will have erectile dysfunction. All right. And then what will that do? It will feed into your head saying that, oh, now I have a problem. Okay. So
Exactly.
So you develop anxiety.
Betul,
What will that
betul.
do? That will add on to the problem.
Betul. And then kalau kita lihat juga kepada di situation, mungkin tambah daripada apa Deeban, sebagai kami tengok senario ni di klinik kan, lelaki ni mungkin kerja lambat, balik lambat, and then mungkin the wife kat home, and when that doesn't happen because the badan tu terlampau stress, the perspective of the wife might also think and start asking questions that, look, what are you doing outside?
Exactly.
Who are you seeing outside? Dia akan macam create this. Sebenarnya dia tak buat apa-apa pun. Dia pergi kerja je, kesian Muhammad ni. So and then he comes to the clinic and tells like, doktor, saya tak tahu lah kenapa saya ni tak buat apa-apa pun. Saya tak curang apa-apa pun. Tapi isteri saya hari-hari give this opinion that, oh, you're doing this, you're not telling me. See, you cannot do it at home. This one, that one. So that physical stress now becomes psychological stress and physical stress.
Exactly.
Jadi combination. And juga satu lagi senario di mana see, most of the intimacy sekarang ni, kalau buat survey lah, berlaku pada waktu malam.
True.
And both partners are
Tired.
tired.
Yeah.
So it's like me blaming you, you blaming me kind of situation
Yeah.
will happen. The day the husband feels like dia nak bersama, isteri kata aku tutup kedai. hari isteri pula buka kedai, suami kata
I tutup.
aku tutup kedai pula. So that situation has, so sometimes there's also a perspective yang mungkin, would you consider like advising your patients to schedule intimacy?
I don't necessarily say you must schedule your intimacy, but I think what needs to be said is that kepada semua lelaki dan wanita lah, okay. So wanita, please take note. Lelaki bukan boleh buat sentiasa. They are not always raring to go. Ada masanya di mana memang dia penat, dia tak akan ada mood nak buat apa-apa. It's not like kalau dia nampak you in a provocative position or in a or just dia nak that will entice him to be with you. Tak semestinya. Okay, there are moments where if you feel that there are times where you say you have a headache, there are moments where men will say they have a headache too.
Fake headache.
Not fake, a real headache lah. Okay, but in terms of, I think between a husband and wife, this was a patient, right? I would say, okay, this is a situation. Okay, it's not that you have a physical problem, but if it's because of stress, you have other things that come into your mind, or you are just tired, talk it out with your partner. Make her understand. Or sometimes I consult both of them together.
Yeah, I think sometimes bila kita ada patient yang ada masalah kesihatan lelaki kan, it's very good yang isteri dia pun datang bersama. Because sometimes ada benda-benda yang we have to talk to the wife rather than talk to him.
Exactly. So
because only then that now I get it why this is happening.
Yes.
She needs to know why.
Exactly. And there's a lot that the partner can do to actually make things better as well. So there are a lot of things like being understanding, or like what you said, buat schedule pun boleh, nothing wrong. Or sometimes I even tell my patient, go on a vacation, leave your stress behind, don't worry about anything else, take some time off for yourself. And most of the time, those who actually do it come back, they say, doc, best advice given,
Fix the problem.
And now I understand what exactly happened. So I don't have a physical problem. My problem was just stress. My problem was self-fed. I brought this problem upon myself. Thank you for giving me a relief. So now I know what to do about it.
True. And selain daripada masalah emosi fizikal, there's satu lagi komponen yang unik yang berkait tentang sistem saraf. Kita tahu dalam badan manusia ni dia ada dua jenis sistem saraf, simpatetik dan parasimpatetik. Simpatetik ni ialah hormon-hormon yang signaling daripada sistem saraf yang menyebabkan kita punya kenaikan paras tekanan darah, denyutan jantung, and also not erection. Simpatetik bukan erection. Tapi ada lagi satu segmen yang control atau regulate, nama dia parasimpatetik. Dia pula menenangkan badan. And kalau perlukan satu ereksi yang bagus, I always tell my patients is, kalau you dalam fight mode,
you won't get an erection.
Kalau you relax, you tadah, dia akan ada simple theory. So Do you see that people any suggestion yang you ada like to handle this kind of
Okay.
situation?
So coming back to your sympathetic and parasympathetic analogy lah kan. Alright. So contohnya orang yang stress. Alright. So stress is big. Okay. You might not even know that you are stressed, but you are stressed. Right. So most often, be it physical stress or be it financial stress, whatever that eats up your mind doesn't make you sleep, get good sleep at night. That means you are stressed. You're always worried, anxious.
For me, very simple. When the parliament is open, I'm stressed.
When the budget is about to be announced, you're stressed.
So I don't even watch these days.
Alright, so for a lot of them, at the month end, they're also stressed. So, but either way, when this happens, that means you akan ada aktiviti simpatetik yang berlebihan. Right. Fair to say, your blood pressure goes up, you start worrying, you cannot sleep, you got more wrinkles on your face, all of those things, right? Of course, you know that you're not going to get an erection. Because your sympathetic is overtaking your parasympathetic. So, to activate your your parasympathetic nervous system, you have to do everything else to relieve it, isn't it? So, exercise or take some time off, do things that you enjoy, try not to think about your stresses, you deviate your thoughts, spend more time with family. Sometimes that can be stressful by itself, but if that's truly something that you really enjoy, you want to go do things, go for a drive and all of that, you would see that actually helps to activate your parasympathetic.
And then females jangan lupa bagi massage kepada suami supaya dia boleh distress sikit sebelum apa-apa.
Suami pula jangan pergi ambil massage dekat tempat luar pula. So can always ask your wife to massage lah. So better relationship with your wife also.
Sure.
Alright, so,
and tadi you cerita tentang driving kan. And one thing I perasan, you know when we drive, kalau kita bawa dalam macam 20 ataupun 30 km sejam kan, we technically can drive at a very relaxed position.
Yes.
Agreed? Okay. Now increase the speed to 100 to 120 km per hour. Ada tak rasa konsentrasi you akan mula meningkat?
Of course, you will become more vigilant, you become more stressed out.
Technically the sympathetic drive akan mula meningkat.
Yep.
And kalau you drive for long distance, your intensity of your sympathetic drive is very very high. and then this saya selalu nampak bila ada pasangan suami isteri yang PJJ, pekerjaan jarak jauh atau pendidikan jarak jauh atau percintaan jarak jauh, whatever you may call it. Suami kerja kat Johor, isteri kerja tinggal kat KL. Suami ni hari Jumaat habis kerja je drive balik 4 jam. Balik je, this female is thinking like, balik je action on. Balik tak boleh perform. Sangkut dekat sungai besi 1 jam. So when I tell this couples and say, you know why benda tak berlaku, then say, kenapa the next day doktor boleh tak ada masalah, Sabtu tak ada masalah, okay je. I said, you are having so much of attention dekat jalan raya untuk 4 jam 5 jam, and you balik, you betul-betul penat, you cannot focus. So I will tell the wife kan, kali kalau ada situation kan, kalau let's say when you pergi holiday kan, driving ke Malaysia, biasanya suami yang bawa.
Tukar lah.
Pergi sana je dia nak bersama kan. The guy is like, I'm like tired or disorientated. So it's you need to allow the body untuk buat recovery baru boleh.
Exactly. Correct.
Anything else that you see, you know, on this segment of macam dari segi kesihatan lelaki ni, on the brain aspect. Okay.
So in terms of what? In terms of erection and all of that. Okay, in terms of erectile dysfunction, I think from a psychological aspect. Okay, so a lot of it, like I said, we cannot differentiate. What has happened is, come to a point, kita dah tak boleh nak buzzing, pinpoint is one thing. Kita tak dapat nak bezakan this is realistic and this is not. Okay, we are driven so much by the content that we consume that we think that everything must perform according to that. That becomes a reality, you know. So it's not that. So like I said, you know, man is not always raring to go. If you're tired, rest. You definitely cannot perform. But like today, you say, oh, if I am tired also, I need to perform. One thing. Second thing is they start comparing in terms of age also. They're like, Doc, when I was 20, no problem. If I'm tired also, I can do it. Now I'm only 30 years old, but I already feel the side effects. Yes, true. Your body requires more rest now because you are getting older. Your muscles are not working. It's like a car lah. You can drive your car at 180 kilometers an hour when you first bought it, but you can't do it 5 years down the road. Your car is going to give you more problems.
Betul.
Same thing happens with the human body.
Betul. And I think lagi satu benda yang saya nak tambahkan juga, this media is also playing a huge role into the brain health. Okay. Kenapa saya katakan begitu is, kalau kita lihat dari segi konten macam saya ceritakan tadi, lelaki sekarang dibombat ataupun dibekalkan dengan pelbagai jenis konten yang mungkin katalah semi-arousal.
Okay.
Semi-stimulating or soft stimulating your sexual behavior orientation. If you keep being stimulated in that direction, apa yang akan berlaku is, when you are placed into a real scenario, what you are seeing is like the top 1% of beauty are on there, and then you are married to an average person.
You don't feed off.
You don't feed because you have access to worse still, like OnlyFans and porn and stuff like that.
Yeah.
And now got even all of this, you people can subscribe to this channels locally. Tempatan pun ada, bukan international, local made. Okay, so this dark webs or this dark spaces is, they're paying like RM20, RM30 to have access of monthly access to this thing. Don't you think the brain is being fed like, you know what?
Yes.
I can have access to beribu-ribu wanita kat luar sana daripada just
so
going to one, just being faithful to one partner.
Correct. So that also affects, because that will primarily affect your arousal lah, basically, because now what happens is you are tuned to be aroused by all of this content, which may be real, may not be real lah. Okay, so let's say we put at the top one, but it's designed to induce arousal in you. Okay, but the more you consume, the more you get exposed. All right, what happens is your brain starts craving that for arousal. Okay, same thing.
I need to achieve that kind of a content, or that kind of visual stimulation, that kind of stimulation for it to actually arouse you. All right, same thing goes with masturbation also. Okay, we never say masturbation is bad. I never say masturbation personally. I never say masturbation is bad. Okay, but it can become a problem. Especially if, for example, you are abusive. Abusive in the sense of you masturbate compulsively. For example, all right, 20-30 years you masturbate 5-6 times a day. You can't spend your day without masturbation, for example. Okay, even if you have something important to do, you need to masturbate first and all that. Over time, what happens is your brain gets tuned to think that is the only sexually arousing thing to you. So if you're put in a situation where, okay, now you're married and then suddenly you need to, or you're with a partner and your partner wants to initiate sexual contact, okay, your brain cannot perceive that as sexual arousal. Your brain doesn't get aroused by that. Why? Because it's only used to one kind of sexual stimulation, and it was done compulsively. True.
All right. So that is also another psychological problem.
And then the excess of like I always do this comparison and katakan like, you know, the kids of the 80s or 70s had only access to maybe magazine or one bloody CD that was running around the whole school. But today
you can subscribe to anything you want.
Yeah, anything you want, and their friends are sending it to you. You don't have to send. People will send
it to you. Exactly.
So and these people are like, okay, I don't like this, I flip that. So like perpetually in like one point of stimulation, you are having access to like 20-30 individuals. So that's crazy to the brain. It's like a huge
Yep. And also sometimes because it will become unrealistic things that will never happen in real life. Okay, yang akan give that arousal. Okay, and people can and that can become a problem. Like for example, to be very open. Okay, so like someone consumes materials like for example BDSM or sadomasochism and all of that. There's so much of those consumption of those kind of material. That's the only thing that arouses them. You don't expect your wife or your partner to engage in those behavior.
Betul. Very true. Very true.
And then and that leads to a problem, right? And okay, without understanding that your mind has actually been altered, your arousal has been your stimulatory what stimulates you has been altered. Then you sort of self-feed this onto yourself. Right. So and then it leads to a lot of other issues that potentially brings up stress. That also adds up on you.
So it's very compounded lah.
So it's a compounding effect.
I think one last good question is like, apa nasihat for penonton di luar sana? how to fix this problem. If they are going through this,
Okay.
and they have just having this thought idea.
Okay, so very simple. If you're now, when we talk about erectile dysfunction, right? Kita bincang tentang masalah mati pucuk ni. Okay, masalah mati pucuk ni boleh menjadi gejala sahaja ataupun boleh menjadi masalah yang lebih persistent lah, yang permanent lah. Okay, yang lebih mendalam. Okay, so if you're having masalah mati pucuk, okay, and fikir balik, apakah yang menyebabkan? So tengok balik, adakah am I stress? Adakah I tertarik dengan partner? All of this. Or adakah contohnya I tengok pornografi, I dapat erection yang bagus, I nak bersama dengan wife, I tak dapat erection yang bagus sangat. Okay, any of these things means that you might be having a psychological component to this problem. So talk to your doctors, talk to psychologists, talk to psychiatrists. There's nothing, tak ada apa-apa yang malu kalau kita nak pergi berjumpa dengan counselor, kita nak pergi berjumpa dengan psychiatrist. There's nothing to be ashamed of.
And there's also sekarang ni a lot of like well-being coaches, mental coaches yang kalau you don't want to see doctors first,
you want to go and see a counselor, you want to go and see this coach, by all means go ahead, no problem, seek help, because masalah kesihatan ni bukan sekadar badan sahaja, fungsi badan sahaja, fungsi minda lagi penting sebenarnya. Okay, if your brain is working well, your mind is working well, your body will follow through. Right. So if this is the problem, if you're not sure, talk to someone. Be it anyone who is, I would say, has a good understanding, good understanding of the problem. Okay. Not sure? Come and talk to us. You and me both. All right. And then get the help that you need. Okay. Once you know what to do, stick with it. That's the most important. Compliance is another issue. You know the problem already. Let's say if I know pornography is a problem, I need to be compliant to avoid it. I need to do all those that I can to avoid those kind of triggers so that my life improves. So getting compliant to the therapy is another issue.
Yeah.
So that is something that they really have to follow through lah.
True. Okay.
Alright.
So thank you so much.
Thank
Terima
you,
kasih
Dr.
Dr. Deeban kerana sudi datang ke episod Lesung Batu kali ini bersama dengan He Medical Clinic. So one take home message is sometimes kesihatan lelaki ni bukan hanya bergantung pada masalah hormon ataupun gaya hidup. Sometimes dia melangkaui ke masalah emosi, dan emosi ni boleh diprovoke ataupun disebabkan oleh pelbagai jenis faktor. Dari segi sama ada kesihatan, dari segi relationship dengan pasangan, ataupun masalah pekerjaan, finance, dan juga masalah how we manage our recreation. Recreation ni banyaklah, dadah lah, pergi ke tempat-tempat yang bukan-bukan, expose kepada content ataupun video yang berunsur lucah dan sebagainya, and it actually infect our brain. So not all therapy datang daripada ubat. Sometimes some therapy is datang melalui pendekatan, discussion with the right people. Okay, so sehingga kita bertemu di episod yang akan datang, jangan lupa untuk like, subscribe dan follow Lesung Batu Medic Show and Sembang Sehat Dr. Deeban. Sehingga kita bertemu di episod yang akan datang. You nak lesung tak?
Boleh.
Okay.
Yo.
Okay, kita lesung kau. Bye-bye.